This is Dr. Bulow, and today we're talking to Barb. And I had to do it with Barb because Barb was telling me about the coolest, really interesting result that you had after you got your first upper cervical adjustment.
Well, when I was in my mid-20s, I had a fall from a lawn chair on a metal balcony, and that started a lot of problems, which I had most of my adult life.
Yeah.
And other chiropractic had been able to maintain that for me, where a lot of times I would have problems, especially in the wintertime and cold weather, getting colds and getting the flu very quickly, and then having problems actually where actually my chest would hurt. And but chiropractic that I'd gone to before was able to at least relieve that and open it up. And so that's what I did until I came here. Actually, I had gone to a cooking show.
Oh, really?
And you were there. Yeah. And you had your equipment there, and you were able to screen my neck. And my head wasn't on straight.
So you had a twisted spine, a bit of documented scoliosis. You got your neck adjusted. And how did that all go after that?
Well, I had been told before that I did have the scoliosis by an orthopedist and also by the chiropractors that I'd gone to, and the x-rays showed that. Once the atlas was adjusted, that I could expect that I could have the other vertebrae would come into alignment, and that to not be concerned if there was some adjustment that was happening, maybe even when I wasn't in the office.
Yeah.
So about 2 weeks into the treatment, it was the middle of the night, and I got awake, and my thoracic area was feeling really warm, and I just felt a little different, and it was like the middle of the night. But I remember what she said to me, that this might happen at any time. So I could tell that there was something changing in my chest, in the vertebrae area, that it was actually rotating. And because she had warned me ahead of time, I didn't panic, and I just sort of allowed what was happening. Sure. And it did rotate a lot. Yeah. And it just went very slowly, but it just was progressing like that. And I told her the next time I came in. Yeah. Well, the treatment here I was very impressed with because it is so gentle. It's a side adjustment which is very gentle. I was very pleased with that. And also I have been able since then to breathe a lot easier. And to take a full breath, and before I couldn't do that. And I have not experienced as many colds and tonsillitis like I was getting, and flu. And so I've seen a lot of improvement.
That's great. So I just think that's so special and so neat that when you get this adjusted, how things can straighten out, and then to have your immune system work better is just so huge, because so many times we just put on antibiotics, or we just go from one cough medicine to the next cough medicine, and all these different things, and really we say, how can we make this body work better? And a lot of times we straighten that spine out, we breathe easier, we reduce inflammation, and that immune system just runs a lot better.
Well, I would say that for decades I've actually had this condition probably for my entire life, and it could have even been a birth defect, I'm not sure. But this has been the most effective treatment that I have had. It's very gentle, and I have recommended this to many people, and I believe that you're in very, very good hands.
If you have any questions, if anyone has any questions, just leave them in the comment section below. If you found this valuable, please share it with some friends. You never know, the lives that you might change. We say that a lot around here, that we will always be here. We will always do the work that we do. But it's people like you, and it's people like you, Barb, honestly, that when you step out of the box and you just share your experience, that you never know what impact that could have on somebody. So thank you for sharing. Thank you for sharing socially if you do, and we'll see you next time.